So good afternoon. We'll begin with some receptors we have already discussed. So we'll discuss about cholinergic receptors. Now cholinergic receptors, as such, it has. So what is cholinergic neurons, right? First question will be what is cholinergic neurons. So neurons which are like formation of acetylcholine is there and release of acetylcholine is there. These neurons are called cholinergic neurons, and cholinergic neurons are like acetylcholine will be acting on receptors which have choline bound domain. So these receptors are basically of two types: muscarinic and nicotinic. Okay, muscarinic M1 to M5 and nicotinic NM receptor and NM receptor. NN receptor means N for neuron or M for muscarine. Okay, M for muscle. Okay, N for neuron, M for muscle. Now this muscarinic receptor is from M1 to M5. Now what is the most common agonist? So this is nicotine for nicotinic receptor, as well as DMPP and PTMA are selective agonist for NN receptor and NM receptor, whereas for muscarine and oxytryptamine are the agonist. Okay, and for all types of muscarinic receptors, atropine blocks all type of, from M1 to M5 it blocks all type of receptors. Okay, selective receptors we'll discuss later. Now this NN receptor and N receptor will be inhibited by hexamethonium, carbachol and triomethaphan, right? These are what? These are N receptor blockers. Okay, these are the antagonists of that. And D-tibocurarine and bungarotoxin, these two are NM receptor blockers. So these are the antagonists. Okay, so muscarinic done, nicotinic done. Okay, now in M1 to M5, M1, M2 and M3 we'll discuss in detail. M4 and M5 are still in research. We are not going to discuss more, because in the Viva the basic questions will be asked like what are receptors, names of cholinergic receptors, and what are the types of cholinergic receptors. Okay, so these are like that. Okay, so like M1 is GQ, M3 is GQ. Now this GQ means it will be having IP3 DAG and it will increase the calcium. Okay, so most important thing you have to understand is that M2 is actually GI, it is inhibitory and it decreases the cyclic AMP, but M1 and M3 do not act via cyclic AMP, it will act via IP3 DAG as well as increasing the calcium. Okay, now in detail, M1, it is where it is located. First of all and most important is the CNS. So M1 is it is responsible for learning and memory. Okay, and autonomic ganglion, depolarization occurs of autonomic ganglion, and because of this M1 receptor, right? And in the gastric glands, when we study the peptic ulcer, the histamine is released, the acid secretion is there because of the M1 receptor. So M1 receptor basically is present in the CNS, but gastric glands one is also very very important. और ये भाइबा में बहुत important question है, पेप्टिक अल्सर जब पढ़ोगे तो यहाँ पे M1 रिसेप्टर ब्लॉकर के बारे में तुमको पूछा जाएगा. ठीक है, तो ये भाइबा के लिए ये कॉमन क्वेश्चंस आर कॉमनेस्ट, तो दिस काइंड ऑफ क्वेश्चंस विल कम. ओके, M2 के बारे में बात करते हैं. तो दीज आर प्रेजेंट इन द हार्ट, मेनली इन द हार्ट. ओके, तो AVN, SAN, atrium, ventricle, right? So these are basically present in the heart, but also present in the nervous system and visceral smooth muscle. So what happens in the visceral smooth muscle? It increases the contraction, but most in atrium and ventricle, very importantly, it decreases the contractility of atrium and ventricle. Okay, that's why the drug was earlier used The M1 blocker drug was earlier used in the some arrhythmias. Okay, we'll discuss PSVT and all, but nowadays it is more advanced drugs are there, right? Now in the AV nodal there is a like conduction velocity decrease occurs when we use this M2 receptor blockers. Now hyperpolarization is there in the SA node. Okay, so most importantly it is also causing tremors and analgesia, and as well responsible for hypothermia, okay, in the nervous system. All right, now in the M3, very important is the glands, okay, and an organ like eye, right, and visceral smooth muscle like the bladder, in the bladder. Okay, so many drugs, most of the drugs, you have to understand bladder physiology when you study. Okay, any problem in the bladder, you use M3 agonist or antagonist. Okay, you will understand what will you use, like agonist or antagonist, something like that. Okay, so important thing is that in the visceral smooth muscle it increases the contraction, right? It also increases the contraction. So we compared the both of them. Now in the glands it increases the secretion, so there is increase in the salivation, right? As well as in the vascular endothelium it increase the synthesis and release of nitric oxide, leading to vasodilatation. ठीक है, तो ये आसान हो गया. Now eye is very important thing. In the third year you are going to study eye in detail, but basic thing you have to understand that M3 receptor is present in the ciliary muscle, and the causes of the contraction, and it causes meiosis due to its action in the iris. Okay, so this is very important, M1, M2 and M3, where they are present and what is the role of it. Okay, now the name of the drugs. Now in the M1 we said that what is the important thing in M1. So in the M1 we have, like, it is present in the CNS. Now M2 is actually an autoreceptor, and M3 is basically a glandular, is present in the eye and muscles. So we have to know the location of M3. So what the important point is, M1 is present in the CNS and M3 is basically glandular. Okay, so one agonist name and another antagonist name, right? One agonist and one antagonist. So pirenzepine telenzepine is a M1 antagonist. Okay, so where do you use? Basically in the peptic ulcer, right? Now there are other drugs. The methacholine, I was saying, it was earlier used in PSVT, nowadays it is not used. Okay, and important thing is this two names, sir, want always in the Viva. Solifenacin and derifenacin are a typical Viva questions, like M3 and blocker name and where it is used. Okay, this is the very important question. Also in the retention of urine and post-operative paralytic ileus, bithanicol as well as carbachol, these two are used. These are M3 agonist. Okay, these are M3 agonist. So move forward, like NN receptor, NM receptor, we have already discussed the agonist PTMA and DMPP. Okay, and we also discussed like nicotine will act on both NN receptor and NM receptor. Okay, so what is the site is the neural, and say neuromuscular junction, and M for muscle, mainly muscular, right? It is also present in the adrenal medulla, where it leads to the release of catecholamine. Okay, and it is present in the autonomic ganglion. Okay, and it also a part of it is present in the CNS. Now important Viva question will be, what is the difference between physostigmine and neostigmine? Okay, so neostigmine and physostigmine, very important. Physostigmine is a tertiary amine, whereas neostigmine is a quaternary amine. Physostigmine is a natural alkaloid, whereas neostigmine is a synthetic derived. Right, now natural alkaloids name, you will be asked name two natural alkaloids, and first important name is the physostigmine, whereas other names you will be also asked about, like atropine and hyoscine. We'll discuss sometime later. Now calabar beans, this term you want examiner wants to listen that, okay, बच्चा को ये बात पता है कि नहीं. Why physostigmine is so important? It is used in the atropine poisoning. Okay, so it is a natural alkaloid and is derived from the plant Physostigma venenosum. Okay, so the nicotinic action of physostigmine is absent, where it is in the physostigmine is absent and the neostigmine is present, whereas in the oral absorption corneal penetration, blood-brain barrier penetration. Physostigmine is a tertiary amine, so it can easily cross, but neostigmine cannot cross. So very important, any brain disease or any problem, physostigmine is used, whereas neostigmine is not used. So even the corneal penetration is there, so it is used in the glaucoma, and it is used in belladonna atropine poisoning. Okay, but most important is, where is the neostigmine used? It is used in the atony of the bladder and bowel, and it is used in myasthenia gravis. It is a very important question, like neostigmine is used here. Pyridostigmine is used in the myasthenia gravis as a test. Okay, tensilon test. You will know about more in the detail in future. Also, reversal of action of the competitive NM blocker DTC is also done by neostigmine. This is a potent Viva question. These are very easily understandable. Now, this important structure which I have drawn over here, A, so it has like this structure, right? This is the structure where I have done a benzene ring, then the CH, okay, CH2OH and COO, and this kind of 6, okay, like this kind of figure, right? So, and there is an N, then is CS3, right? This is a very typical, nobody will ask what is the draw this structure, but this is atropine. Okay, this is atropine, and it is derived from Atropa belladonna, which is also known as devil herb, and Datura stramonium. This is also known as thorn apple. Now, what I want to just show, that these two are this one is this question, and another, if suppose there is an oxygen over here combining this carbon and this carbon, and there is an oxygen over here, right? This is an oxygen. So if we add an oxygen and remove two carbons, then there is a structure called B, and this structure is nothing but scopolamine, and this scopolamine is been derived from the hyoscine is nothing but derived from a naturally this plant. This is Hyoscyamus niger. So there are 3 derivatives I have shown, plant derivatives, and examiner always asks at least name 2 plant derivatives drugs. Okay, the drugs which are derived from the plant. Okay, there are other drugs, chloroquine and all, you will quinine and all, you just remember at least 5 of the plant derived products. Okay, now difference between atropine and hyoscine. Now atropine is a CNS stimulant, whereas hyoscine is a CNS depressant. Very important. Okay, now duration is a longer duration of atropine, whereas in hyoscine it is a short duration. Okay, anti-motion sickness, mainly hyoscine is used because it is a CNS depression, but atropine can also be used, but not used most commonly. Now the very few important question is, what is the drug of choice of motion sickness, morning sickness and mountain sickness? Now मोशन सिकनेस, जब गाड़ी चलाते हैं ना, तो उसमें अगर टर्न्स आते हैं तो उसमें मोशन सिकनेस होता है. मॉर्निंग सिकनेस प्रेगनेंसी में होता है, ठीक है. और माउंटेन सिकनेस क्या होता है, हिली एरिया में जब हम लोग जाते हैं हाइकिंग के लिए, या फिर अचानक से हाइट बढ़ जाता है, तो उसमें माउंटेन सिकनेस होता है, ठीक है. तो इंपॉर्टेंट थिंग इज दैट माउंटेन सिकनेस में कार्बोनिक एनाइड्रेज इनहिबिटर एसिटाजोलामाइड यूज़ करते हैं. मॉर्निंग सिकनेस में डॉक्सिलामीन या इवन विटामिन B6 को, पाइरोडॉक्सिन को भी यूज़ किया जाता है, बट डॉक्सिलामीन इज द मोस्ट इंपॉर्टेंट क्वेश्चन. नाउ मोशन सिकनेस में स्कोपोलामीन को यूज़ करते हैं. तो ऑल 3 सिकनेस आई हैव डिस्कस ओवर हेयर. वाइवा का पोटेंट क्वेश्चन है. नाउ सबसे इंपॉर्टेंट चीज़ जो और इंपॉर्टेंट पूछा जाता है एट्रोपिन से रिलेटेड, वो शॉर्ट नोट भी आता है कि यूजेस ऑफ एट्रोपिन सब्स्टिट्यूट, या शॉर्ट नोट आता है एट्रोपिन सब्स्टिट्यूट. तो यूजेस जब जानोगे तो इंपॉर्टेंट वाइवा क्वेश्चन यहीं से उछल के बाहर आएगा. जैसे प्री एनेस्थेटिक मेडिकेशंस में व्हाट इज द मोस्ट कॉमनली यूज्ड ड्रग, दैट इज ग्लाइकोपाइरोलेट. एट्रोपिन कैन बी यूज्ड, यस. क्या होता है, गला को सुखाना होता है, सिक्रीशंस को कम करना होता है, ठीक है. तो कोई भी एनेस्थीसिया देने से पहले, बेहोश करने से पहले, सर्जरी से पहले, ताकि उसको चोकिंग ना हो जाए, हम लोग ग्लाइकोपाइरोलेट देते हैं. दिस इज अ वेरी इंपॉर्टेंट क्वेश्चन. साइक्लोपेंटोलेट एंड ट्रोपिकामाइड is also used in eye surgeries, in eye also, right? Now in GIT अगर पेट में दर्द हो रहा है तो dicyclomine is used. So this dicyclomine is used in the abdominal pain. Okay. Also in the urinary antispasmodic, if there is a lower pain, tolterodine or flavoxate is used. Okay. As an anti-ulcer, Pirenzepine and telenzepine we have already discussed. It is used. Also very important, ipratropium and tiotropium bromide are used in the bronchial asthma. These are atropine substitutes. Now in the anti-Parkinson drug, what happens in Parkinson? Acetylcholine is increased, okay, and dopamine is decreased. So to decrease the side effect of increased acetylcholine, trihexyphenidyl and benztropine is used as an anti-Parkinson atropine substitutes. So these are very very important Viva question. This is the VVIP topic, okay, VIP topic हम लोग बोलते हैं, ठीक है. So this is a must knowing thing before going to exam. And some definitions like define drug, define receptor, and define like antibiotic, okay, defined diuretics, okay. So these few definitions you have to know by tip of the tongue, and drug is like WHO definition, okay. So this is very very important topic. Some commonly used drug, remember this thing, common is commonest and rare is rarest. So what happens in medical science, like common diseases you will see commonest, okay, common drugs you will use it very commonly, okay, that will be asked in the question, okay, that will be asked in the Viva. But rare is rarest, some the ulta pulta syndromes, okay, मतलब रेड मैन सिंड्रोम, ब्लू मैन सिंड्रोम, यस दीज आर इम्पॉर्टेंट बट दे विल नॉट आस्क. अगर बहुत अच्छा आंसर दोगे तभी ये रेड मैन सिंड्रोम और ब्लू मैन सिंड्रोम के बारे में पूछेगा, ठीक है. सो अगर जब डिस्कस कर ही रहे हैं, सो व्हाट इज द क्वेश्चन दैट वेयर रेड मैन सिंड्रोम एंड वेयर इज ब्लू मैन सिंड्रोम फाउंड, राइट. तो वैनकोमाइसिन में रेड मैन सिंड्रोम और एमियोडेरॉन में क्या होता है, ब्लू मैन सिंड्रोम. तो एमियोडेरॉन में आयोडीन कंटेनिंग ड्रग. सो दीज आर टिपिकल वाइवा क्वेश्चंस, ओके. तो ज़्यादा टिपिकल चीज़ नहीं जानना है, टू द पॉइंट जानना है, बेसिक चीज़ जानना है, कॉमन चीज़ जानना है, बिकॉज यही कॉमनली पूछा जाएगा. रिवाइज द सेम क्वेश्चन, अपना करिकुलम को देखो, है ना, उसी से क्वेश्चन आएगा. बाहर से इधर उधर पढ़ने से कुछ नहीं मिलने वाला, टाइम बहुत कम है, राइट. चलो बाय.